Today, I'm going to talk about acetaminophen versus ibuprofen in young children with mild persistent asthma. Definition: asthma is a chronic lung disease that inflames and narrows the airways. Asthma causes recurrent periods of wheezing, chest tightness, shortness of breath, and coughing. The coughing often occurs at night or early in the morning.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically. Therefore, preventative treatment is used and can be managed by the patient themselves. An acute asthma attack requires medical intervention, but the type of intervention depends on the severity of the attack. For more information,
Application in medicine. Many children younger than 12 years old receive acetaminophen each week, making it the most commonly used pediatric medication in the United States. A post-hoc analysis of the risk of short-term use of acetaminophen versus ibuprofen for febrile illnesses in children similarly showed that the relative risk of unscheduled visits for asthma after the use of acetaminophen was substantially higher than the risk after the use of ibuprofen.
Asthma is a chronic disease that affects your airways. Your airways are tubes that carry air in and out of your lungs. If you have asthma, the inside walls of your airways become sore and swollen.
In the United States, about 20 million people have asthma. Nearly 9 million of them are children. Children have smaller airways than adults, which makes asthma especially serious for them. Children with asthma may experience wheezing, coughing, chest tightness, and trouble breathing, especially early in the morning or at night.
Many things can cause asthma, including allergens, mold, pollen, animals, irritants, cigarette smoke, air pollution, weather, cold air, changes in weather, exercise, infections, flu, common cold. When asthma symptoms become worse than usual, it is called an asthma attack. Asthma is treated with two kinds of medicines: quick relief medicines to stop asthma symptoms, and long-term control medicines to prevent symptoms.
Pros and cons. Ibuprofen has pros and cons. Pros: don't contain gluten. Is used to help prevent blood clots, which can cause heart attack or stroke. Cons: and sometimes cause a stomach ulcer to develop. Increases the risk of cardiovascular events such as heart attack and stroke.
Living with asthma can be a challenge. Now you can get relief from.
When you're not having asthma symptoms, your airways are clear. Air can easily flow in and out of your lungs. When an asthma attack begins, the smooth muscles around the outside of the tubes may tighten. The airways, or bronchial tubes in the lungs, become inflamed and swollen. This makes it difficult for air to pass through the opening. The mucous membrane lining in the tubes begins to produce thick mucus, which builds up and further blocks the airways. This tightened airway may result in a wheezing sound and shortness of breath, signs and symptoms of an asthma attack.
Acetaminophen. Pros and cons. Pros: cheap, safe, can be given orally or rectally. And cons: small effects, liver damage, is overdose.
It's one of the most widely used pain relievers around, but a new study finds acetaminophen may be associated with an increased risk of asthma or wheezing in both adults and children. Researchers at the University of British Columbia, Vancouver, reviewed 19 clinical studies involving more than 425,000 people. Results show a slight increase of asthma in children who used acetaminophen and in pregnant women. Dr. David Lang didn't take part in the study, but treats asthmatics at Cleveland Clinic.
So there appears to be an association, and this is another study which confirms this. What has not been shown is whether the removal of exposure to acetaminophen leads to a lessening of the prevalence of asthma, and more studies are required to demonstrate that before we can make management recommendations.
Complete findings of this study are in the journal Chest. For Cleveland Clinic News Service, I'm Mike Jacobson.
Issue applied in Ecuador. In Ecuador, the use of ibuprofen and acetaminophen in asthmatic children is very common. However, while ibuprofen is an anti-inflammatory that acts on prostaglandin, which is an inflammatory substance in the pain area. The Hospital Roberto Gilbert said that if it is ingested by a child who has a susceptible stomach, it can cause erosive gastritis or bleeding, and in high doses can cause in children skin rashes, red areas, and difficult to breathe.
It's an age-old question, ibuprofen or acetaminophen, and what's the difference anyways? Hey guys, Julia here for D-News. I got a migraine recently and I popped a few ibuprofen and felt so much better. But that made me wonder, how do major pain relievers actually reduce pain? Well, there are special receptors in your body that respond specifically to pain called nociceptors. They protect us by responding to potentially damaging stimuli like a burn or a cut and send a signal fast to the brain. Once your brain gets the signal, ouch, this hurts, your body is already going to work to heal the wound. Most injuries get hot and swollen, but this is your body trying to protect itself. By swelling, the body might prevent further injury by immobilizing, say, a joint or whatever, and the heat might be the result of increased blood flow or might cause increased blood flow, which means more healing immune cells get to the point of injury. Another thing injured cells release is arachidonic acid. The two enzymes, COX-1 and COX-2, react with this acid to produce prostaglandins. These can create other chemicals which are responsible for all that swelling, heat, and pain. And this seems to be the target mechanism of non-steroidal anti-inflammatory drugs like ibuprofen. Ibuprofen was discovered in the 1960s and in 1983 was made available over the counter. It's originally designed to be an anti-inflammatory drug. It works by stopping the production of prostaglandins by blocking one of the active sites of COX-1 and COX-2. When ibuprofen is in the active site, arachidonic acid can't fit, so prostaglandins can't be made, and thus the heat and pain-causing swelling is reduced. Acetaminophen, on the other hand, isn't an anti-inflammatory drug. How it works? Well, that gets a little complicated. It was first discovered in the late 1800s and really didn't reach the market until 1955 when it was marketed as Tylenol. And really, nobody's quite sure how it works. I'm not kidding, there are a lot of ideas, but nothing conclusive yet. In 2002, scientists in England discovered another COX enzyme and they labeled it COX-3. This new enzyme can be found mostly in the brain and it seems more sensitive to acetaminophen than other anti-pain medications. But unfortunately, this only seemed true in tests with other animals. Another idea is that acetaminophen works differently on COX enzymes than ibuprofen. COX enzymes have two active sites, one that arachidonic acid binds with, and another, the peroxidase side, which leads to the production of a tyrosine radical. It's this other active site that acetaminophen might bind with, preventing the body from making this compound, relieving some pain. Or another idea, and this one is my personal favorite. Researchers from Lund University in Sweden thinks acetaminophen actually works on the endocannabinoid system. If that word sounds a little familiar to you, yes, it's the system that responds to cannabis or weed. But it's also involved in a lot of different processes like appetite, pain sensation, mood, and memory. So the researchers claim that acetaminophen activates two ion channels in the brain and spinal cord, and that these channels also respond to certain cannabinoids. But the researchers caution that these channels can actually trigger pain and itch responses. So it seems odd that activating them reduces pain, but they might be onto something. Another study published in the European Journal of Pharmacology shows that blocking cannabinoid receptor type 1 prevents acetaminophen from relieving pain in mice. But there's a few other ideas of how the drug works, like maybe it works on serotonin receptors, but who really knows right now? So even for a drug as old as acetaminophen, it's clear more research is needed. Alright guys, the real question is, are you a fan of ibuprofen or acetaminophen?
Conclusion. In conclusion, the scientists not finding that asthma, exacerbations, or other markers of asthma-related complications occur more frequently among children who were randomly assigned to receive acetaminophen than among those who were randomly assigned to receive ibuprofen.